Hi everybody, Dr. Vito here, and today I want to speak with you a little bit about a common thing that we encounter in our culture today is hypertension, right? High blood pressure. So to talk a little bit about that, just to explain essentially the concept of blood pressure is that obviously our heart is pumping oxygenated blood out through our vessels so that we can get oxygen and other nutrients to all the organs in our bodies. The thing that happens though for some of us is that our bodies create excess tension in those blood vessels. That happens in one of two ways. Either the blood vessels themselves, the muscles are becoming hyperactive and they tense down, or the blood vessels lose elasticity. And so what happens is as blood courses through those vessels, they're supposed to get a little bit of a stretch and then a contraction, kind of like if you fill up a balloon, right? It's going to fill with air. If you were to let go, it would push that push that air out. Our blood vessels are supposed to do the same thing, but from years of oftentimes poor diet, they lose that elasticity, and so instead of having that natural give and take, the muscles have to kind of pick up the slack and they tense down. Okay, so really the question is, what causes high blood pressure? Well, if you were to ask your common medical doctor, a lot of the times they don't really delve into that very much, right? They might talk a little bit about salt, they might talk a little bit about hormones, but too many patients, in my opinion, come to me and say, I'm on a blood pressure medication and it will be for life. That kind of breaks my heart because there's not a single drug that doesn't have a side effect. So if we take something on a chronic basis for decades and decades, we really have to ask the question, what kind of damage is that doing to our bodies? And really the bigger question to ask is why, right? Why should I have to take a medication for the rest of my life? And why do I have high blood pressure in the first place? So today I'm not going to talk a ton about chiropractic and hypertension because there's not necessarily a miracle cure, though I'll share a study with you that was very successful. But really I encourage you to make sure that you're asking the right questions when it comes to your health. You have to ask the question why, right? Our bodies don't do things for no reason. So oftentimes if someone has high blood pressure, it can be a chronic sympathetic state where they're under a lot of mental stress, and that kicks up certain hormones in the body that trigger them to have high blood pressure. Like I said, it could be their diet. A lot of times it's also a lack of metabolic strain. When you exercise more, it actually sends a signal into certain cells to create enzymes like nitric oxide synthase, which actually release nitric oxide, which opens up blood vessels, makes them more elastic, helps to replenish our system. If we're sedentary, if we're eating poor foods, right, we're not getting good fiber, we're not well hydrated, we're eating a lot of sugar, all those things add up. Is the answer to take a drug? No, the answer is move better, eat better, right? Think better, decrease some of those stresses in your life. So my encouragement to you is make sure you're asking the right questions, and please, if you're on a medication, ask your doctor, when will I get off this medication? How can I get off this medication? Those are the important questions to ask. And so to conclude, I do want to share, in about 20 years ago, there was a very big study done out of the University of Chicago looking at the relationship between chiropractic and hypertension. It was specifically targeting the atlas vertebra. They assessed the participants in the study for subluxation, and what they found was the patients that received the corrections, the adjustments, compared to the placebo, had a decrease in their hypertension that was equal to 2 blood pressure lowering medications. So that was a very huge study. It was all over the news that chiropractic adjustments done specifically for the atlas bone have been shown to decrease hypertension in a very natural, very safe and effective way. So that just shows you how important that relationship is between the spine and the nervous system, your overall health. If you have hypertension, the first question you have to ask yourself is why? What is it in my lifestyle or what's going on in my spine that's contributing to that? We're here to ask the right questions, and we're here to help you do the same. If there's anything we can do for you, please let us know. We'd be happy to do an assessment for you and your loved ones. Take care.